I've had a lot of people ask me to do a video talking about hypersexuality, so that's exactly what we're going to talk about on Polar Warriors today. We're going to get into the specifics of it, symptoms, concerns, treatment, and a lot more. Now, just a fair warning, this video is going to discuss some aspects of hypersexuality that might not be suitable for children, so please keep that in mind before you crank up the volume on your device. This is a very in-depth subject with a lot to cover. I don't want to split the video into multiple parts to chase around, so please stick with me and you're going to learn a lot with this one. My channel is primarily dedicated to bipolar disorder, so if this is your first time visiting us, a very warm welcome to Polar Warriors. All right, so first off, I want to mention how many articles and books there are on the topic of hypersexuality. Everyone has no problem getting behind a keyboard and typing all about hypersexuality, but if you search for a video of someone talking about it in person, they're really far and few between. This is part of the problem, okay? Nobody wants to talk about it openly. Mental illness is already hard enough to discuss, so when you add sex on top of it, watch out. For those of you who don't have bipolar or another disorder common associated with hypersexuality, please don't waste your time making comments like, that's just puberty, or that's a teenager's life, or some kind of big pharmacy conspiracy. I've heard it all. Hypersexuality goes way beyond such a narrow scope, and it affects people of every age group indiscriminately. It's destroying relationships and jobs, and people are dying from diseases associated with it every day. So needless to say, this is a very serious issue, not just chalked up to teenage hormones. Now that we've gotten that out of the way, let's jump right into it. Depending on the source quoted, it's estimated that 25 to 80% of all manic bipolar patients will experience hypersexuality. The average is quoted to be around 57%. Now, that's a lot, and the percentage, of course, varies with age, lifestyle, if substances or medication side effects are in the picture, and a lot more. I've also found it interesting that some studies noted that hypersexuality plays a larger role in the lives of bipolar women than men. Let me know what you think about that, and please be constructive in the comments below. So, what is hypersexuality? Well, that's a really good question that was probably never addressed when you were first diagnosed having bipolar disorder. I mean, am I right? I have never had a doctor or a therapist mention it to me or my partners, and I've seen some pretty good doctors. Most people have no idea what they're going through at first, so unless it's brought up by the patient, doctors tend to just leave that one on the table. If it affects up to 80% of people suffering with bipolar disorder, I think it's worth at least mentioning, thus the importance of making a video like this. Hypersexuality is an overwhelming compulsion to have sex or to look at sexual material. It can be compared to the sensation of craving water when you're extremely dehydrated for some people. They get that butterfly feeling in their stomach or that intense high that can give a massive boost in self-confidence. Some describe it like having temptations so strong that they can virtually feel like they're crawling out of their skin with sexual anxiety or desires. One of the worst parts is never feeling satisfied or constantly trying to battle a carnal nature in their body that seems to be on autopilot. For couples who realize that this might be a part of their relationship, it is crucial that both partners become educated about hypersexuality and specifically the triggers that contribute to it. I can't even count the number of people who have asked me about this, and they're usually the partner of someone who has bipolar. But like I said, no one's talking about it. Hopefully by the end of this video, everyone will have a much better understanding of what it is, or at least have a name for the feelings that cause so many relationships to have serious problems. Hypersexuality is loosely defined in the Diagnostic and Statistical Manual of Mental Disorders. It's been rejected up until recently in the United States as a specific part of diagnosis. They basically always put it under sexual deviation and disorders unspecified or sexual disorders not otherwise specified, or NOS. Basically meaning it was just grouped as a subcategory of sexual disorders without the separation or attention that it deserves. To summarize, hypersexuality is defined as a very frequent or sudden increase in libido, but don't take that as an oversimplification. We've all heard the term nymphomaniac in common social slang, and everyone just thinks that it's someone who's addicted to sex, period. Hypersexuality is cyclic, or it comes in waves, basically. So it's a bit different from sex addiction or nymphomania, especially with how it relates to the cycles of bipolar disorder specifically. We're going to get into the common symptoms or signs, but I'd like to use an analogy that most of us can relate to, whether we experience hypersexuality or not, just to put some things into perspective first. So just like an alcoholic craves that next drink, or he thinks that he can stop on his or her own, but falls again and again and again, that's the same level of motivation we're dealing with here, but on a much more primal level. People don't always have to be manic to experience hypersexuality also. A lot of individuals will crave sexual release to escape depression and emotional pain also. It's easy when we're feeling down to just visit bipolarBabesXXX.com to try and chase the euphoria instead of dealing with the symptoms of depression or anxiety. Keep in mind that hypersexuality or sexual addiction is also progressive. Just like alcohol abuse. It might start out simple, like excessive masturbation while watching porn. Eventually that can progress into other types of dangerous or high-risk sexual behavior without any regard of consequence for ourselves or the feelings of others. Now, that doesn't mean if your partner watches porn every once in a while that they're going to turn into some sexual deviant, okay? Just like a person who has a beer or a glass of wine with a meal, there's really a difference. For those of us who act on our hypersexuality, we get that same euphoric, intoxicating high that many of us experience during euphoric mania. It's a way to basically chase the mania, to keep the party and the endorphins going. But like with any manic or high episode, there's usually a crash associated with it. And then the whole vicious cycle just seems to start all over again. It's like a trampoline. The higher we get, the farther we have to fall back down until we bounce back up again. Most of the time, the sexual act doesn't have any emotional connection like love associated with it. It's not fulfilling, and it can have a horrible impact on our lives or cause personal shame and feelings of self-loathing during the come down. The specific symptoms of hypersexuality or how it's expressed can vary from person to person. For example, some people will go out and cheat on their partners multiple times, while others will stay up all night in the basement watching bipolarBabesXXX.com. And that's not a real website, by the way. So here's some of the most common symptoms of hypersexual behavior. The first would be excessive masturbation. That's probably the most common and usually accompanied by pornography to make it even more stimulating. Next would be obsessing about sex, where it basically dominates your thoughts and starts to interfere with life in general. If you're thinking about bipolar babes instead of paying attention to the professor lecturing, there might be a problem. Then there's the planning, like devoting a lot of time to setting up the next sexual encounter to get that fix, very similar to a drug addict looking for the next score, so to speak. One of the next most common signs would be looking at porn, and a lot, like every day for hours on end. This could be online videos, magazines, phone sex or sexting, webcam sex, spending lots of money on porn services, or using hookup dating sites where most people are just looking for sex and one-night stands. Another really common one is staying emotionally disconnected from the people that they sleep with, regardless of how the other person feels. It's really common for sex addicts or those in a hypersexual state to not have a healthy connection with their sexual partners. Like sleeping with them and then wanting nothing to do with them after they get their fix, so to speak, or only calling them up when they're hypersexual. Now, this next one is serious, and I'm talking deadly serious, and that would be frequently having sex without protection. High-risk behavior is probably one of the top signs of bipolar mania in general. During periods of hypersexuality, the individual might be so driven to satisfy their cravings that the thought of consequences just go right out the window. This not only affects the bipolar individual, but if they're in a relationship and cheating, this puts their partner at equal risk. People die every day from STD complications, and it's not a pleasant way to go for you or your loved ones. If you're worried about yourself or your partner, get tested, like today. The next sign of hypersexuality includes engaging in sexual behavior that goes against your personal values, religious beliefs, or even what society deems appropriate. For example, someone who's a devout Christian cheating on their partner, having sex with someone underage, or having sex with prostitutes. Even though they believe it's morally wrong, they still do it anyways. So the next one would be obsessing over what you can't have, like someone else's wife, or a coworker who's already said no, or someone like a celebrity. This kind of fixation could lead to things like stalking, harassment, spying on people through their bathroom windows, and in some cases even violence. Next would be a total escalation from normal missionary position, for example, to cheating once and then cheating multiple times, and then visiting sex clubs, and then getting into exhibitionism or voyeurism or sadomasochism, and on and on and on. It goes back to the drug addict analogy of using like gateway drugs that lead to something harder or stronger, and then you need more and more to be satisfied until it's just completely out of control. Now, it's really important to know that I'm not saying everyone who's bipolar gets hypersexual and goes this far. And there's people with very loving relationships who just like to push the limits of their sexual exploration together. It's when it gets out of our control or our awareness and starts to hurt us or those that we love that it becomes a serious problem. It's also extremely important to know that hypersexual behavior is a symptom of an illness. It's a common symptom of bipolar mania. Now, that never excuses bad or hurtful behavior, but if it can be approached as a symptom, it's easier to not focus so much on the emotions involved and more on the treatment or a treatment plan to prevent it in the first place. That being said, let's get to the many treatments for hypersexuality and how it can be minimized or prevented. In the 70s, the concept of hypersexuality started being associated with addiction when former members of Alcoholics Anonymous noticed that they had an equal struggle with sexual behaviors as they did with alcohol. Even to this day, the therapeutic approach is very similar in that someone first has to realize that there's a problem and engage in some sort of ongoing therapy or support groups. This includes psychotherapy, group therapy, family or couples therapy, and self-help methods that are out there. Many people also take natural approaches to reducing sexual urges or hypersexual urges by having a strong outlet like exercise, or changing the foods that they consume, or taking herbal remedies or supplements to help. Sometimes that might not be enough though, so pharmaceutical medications have also played a key role in treating hypersexuality. Some of these meds are designed to reduce the compulsive or obsessive behavior in general, while others might target specific hormones associated with sex addiction. For those of us who have bipolar disorder, the more we can treat the root symptoms like depression and especially the mania, the easier it is to get the hypersexual urges under control. If you treat the bipolar disorder first, many of the things like just start falling into place basically. Antidepressants like SSRIs are probably the most commonly used to treat hypersexuality or sex addiction. These are drugs like Paxil, Prozac, Zoloft, and others. Mood stabilizers are also another common class of drugs used to not only treat bipolar disorder specifically, but to also help reduce intense sexual urges. These are drugs like lithium, Depakote, Seroquel, and others basically. Other classes of drugs are sometimes used, and these are called either anti-androgens, which target male sex hormones called androgens, and they can help reduce sexual urges basically in men. And another class of meds are what is known as luteinizing hormone-releasing hormone agonists, or LHRH drugs. I know that's a mouthful. These are designed to decrease testosterone production and basically help control the obsessive thoughts associated with hypersexuality. Now, All of these medications have to be used very carefully so they don't affect other bipolar symptoms. Some can make the mania worse, while others might increase the depressive episodes. On the flip side, these meds can also cause a drastic drop in sexual desire, so much so that it can impact relationships in a negative way. It's a delicate balance, and it can take time, sometimes even years, to find that sweet spot. But isn't even a few years worth enhancing the rest of your entire life and saving your relationships? Remember, we want to win the war, not just the battle, so it's important to keep overall balance in mind. So what are the causes of hypersexuality in the first place? Now, I'm not talking about bipolar mania, which is obvious. I'm talking about what experts think are the root causes at this moment. Well, unfortunately, I found there's not a lot of consensus when it comes to this, but some of the research is suggesting that it could be linked to biochemical, biological, and/or psychological aspects as far as the root cause. For example, some have tried to relate it to injuries or damage to the temporal or frontal lobes of the brain, while others have linked it to hormonal changes or exposure in the body, especially at early childhood development. Hypersexuality has also been attributed with a lack of physical closeness, the overactivity of dopamine pathways in the brain, or even side effects from certain medications. These theories can get quite complex, and I didn't find anything definitive, so for now we can just hope that the research helps narrow things down a little more so we can learn more about it. Okay, we have covered so much information about hypersexuality, your head is probably spinning. If you've made it to this point in the video, thank you for sticking with me to learn about this. And if you need to come back and watch this again to digest everything, please do. The very last thing that I want to say is how important awareness is with what hypersexuality means to you. Become acutely aware of how the symptoms manifest for you so that you know when to get help or to talk to your partner. Be open and honest with your partner, and especially with yourself. Talk about this stuff. If you're the partner of someone who has bipolar hypersexuality, it's crucial to be open-minded and not punish your partner for discussing something or expressing something sensitive, because it can cause them to shut down and stop telling you how they feel, or worse yet, what they might have done. You can also often notice symptoms or behavior that we might not be able to see, especially when we're ill. So the kind of gentle observations of others around us can be a huge key. If the hypersexual individual can admit that there's a problem, or they're open to help in the first place. Anyways, thank you so much for watching. Please remember to send a giant digital thank you by subscribing to Polar Warriors. It really helps get these videos out there on YouTube so other people might see them. And we'll see you here soon for another Polar Warrior video. Stay well.